My name is Dr. Charles Harrigan. I am a teacher and have been a teacher for the last 30 years. My doctorate is in educational leadership and supervision. I was diagnosed around August of 2016. Actually, I didn't have a whole lot of symptoms. I was only diagnosed because I did have some frequent urination, but I was diagnosed because my PSA count had gone up over the space of 12 months. It went up approximately a whole point, which is a definite sign that something is going on in your prostate. So my doctor recommended that I do a biopsy, did a biopsy, found out that I had cancer in 3 out of 4 quadrants of my prostate. There was a couple of things. One, you can observe it, try to control it with diet and exercise. I wasn't particularly overweight, so and I didn't feel comfortable with that. I was also given the choice of radiation, external radiation. Didn't like that. Robotic surgery or traditional surgery to remove the prostate. I didn't feel good with any of those options. There was also the option of seeding, where they put radioactive seeds into your prostate for they remain radiated for about 3 months. Because I'm a teacher, that was a bad option for me because I couldn't. Would mean I couldn't be around kids, pregnant ladies, anything like that. The other option was external radiation. I didn't like that because it exposed my whole body to high levels of radiation. Didn't like that. And I was also given the option of something called brachytherapy, where they put needles directly into your prostate and direct a strong dose of radiation to the organ. And after they kind of convinced me that they could maintain that area, the radiation to that area, I think I went ahead with that option. I didn't feel comfortable with cutting because, you know, I'm from the islands and we believe that cancer and cutting spreads rapidly. I had some real bad side effects. And one of the side effects that I had was a burning sensation, bleeding, doing urination, and after using the restroom, I also had prostatitis, where I had inflammation into my prostate, and it was very uncomfortable. Made you feel like you have to go to the restroom every 5 minutes. You couldn't lay down. It was painful. You felt, you know, it was a lot of discomfort. Yes, not after I urinate, more so than in my urine. After I use the restroom to stool, yeah, there was really, because the doctor said everything passes by the prostate, so that caused a lot of problems. Up to 7 months after my PSA count was like 5.9. The doctors recommended, for all the side effects that I was having, the doctor recommended that I take ibuprofen every 6 hours, and then two pills every 6 hours, and then after a while take it down to 1 pill every 6 hours. I never felt good with that because the ibuprofen kind of increased the bleeding and continued the bleeding, so I had problems with that. Aside from the fact that ibuprofen over a long time has a tendency to damage your heart, and just a whole lot of other side effects with that. I actually met a friend of mine. We were in Walgreens together. I'd seen him, I knew him from Atlanta, and I saw him in Walgreens, and he looked like he was going through some stuff. I asked him what happened. He said, well, he was misdiagnosed with cancer for a couple of times, and then they finally found that he had some cancer. I forgot what type of cancer, but all the doctors had no good answers for him, but he knew about, he knew someone who had given him something that was totally alleviated most of the problems that he was having, and he was much better than he was before. And I asked him, well, since I was going through this myself, I asked him for that person's name. I recognized the name before because I had come in contact with Hero before. So when I checked my numbers in the phone, they lined up, so I know I was dealing with at least someone who was well educated, worked at the university before. When I called, I was given, told me where to find the olive leaf extract. It was approximately around November 2016. Well, I first took a couple of teaspoons, and after I noticed that there wasn't any side effects. I wasn't having any side effects. I decided to go ahead and do something like, I wanted to saturate my body with the olive leaf extract, so I took it like a tablespoon every 3 times a day, and I didn't really measure too much. I took a little bit extra because I really wanted it to go through my system. And after a while, after like my first couple of days, I didn't have the inflammation anymore. And after about 2 weeks, 3 weeks, I didn't have the bleeding anymore. And so no inflammation, no bleeding. I didn't have the burning sensation during urination anymore. And I was totally off the aspirins. I wasn't taking aspirins. So I would say within 3 weeks, all of my symptoms have stopped. Since then, that is, we are now in January, so from December to now, the last couple of months, I've had no symptoms, none of the negative symptoms I was having before. In December, I went back and took my PSA. My PSA, the previous time was 5.4, and
that was 5.9.
Well, it was 5.9 when I went to the States, but then when I left, it had gone down to 5. It actually went down to 3.9. Okay. However, when I came back, the symptoms, I went to a doctor in St. Thomas. I won't call his name because I don't want to say any bad things. But I went to him. He did all kind of tests. He did a scope. He did a CAT scan. He did blood work. And his recommendation was that I start taking steroids or something weird. Not steroids, but this, I think, is a hormonal treatment, but it tends to give you enlarge. Your breasts tend to, your chests tend to enlarge. So I didn't want those. So I asked him to speak to my doctor. He didn't speak to my doctor. But when he tested me, I was 5.24. I have the paperwork to show that. I backed away from him completely. That was before I started taking the extract. After I started taking the extract, I kind of got away from him as soon as I could. I started taking the extract, and I went back to the States to my original doctor who did the radiation treatment and did my test, and he didn't even want to test the blood. He looked at me and he was like, "How you feeling?" I said, "I'm great. I feel excellent." Because the last time he saw me, I was really in a lot of pain and uncomfortable. So he asked me, well, I said, well, what are my numbers? He said, they're good. I said, what does that mean? He said, they're really good. I said, what is it? He went back out the room, came back in, he told me, showed me a paper that says 0.45, which meant that I had lost more than 5 points and was in a really, really good place as far as my PSA count. 0.45.
Okay.
One of the things that I think also is that my frequency of urination, it's gone to a manageable place. It used to be around 4 times a night, sometimes 5. I've been down to like 2. I'm down to 2 times a night, which is kind of customary for me, especially for a person that's 55 years of age. 2 times a night is I can get some rest. Blood pressure, oh man, I not to mention, I was taking some statin, some kind of blood pressure medication, because my blood pressure was always a little high, as my doctor was saying. He didn't want my organs, he didn't want it to affect me later on, so he recommended that I take a very small dose of blood pressure medication. After I started taking this, my blood pressure has been in the excellent range. Not good, excellent. 110 over 69, something like that.
Okay.
I'll say, and you know, it took me, I would never do this, but I would recommend, not that I would recommend this, I recommend this to my friends. I have friends with high blood pressure. I have one of my best friends, his mother-in-law was going through some problems. She wasn't even getting out of bed. He gave us some of this. He's been giving her this. He says she looks forward to getting this in the morning. She gets up on her own. She walks around the house, and she's an elderly lady. I would have to get her age for you, but I know she is, if not in her 80s, in her 90s. She get up on her own now. She walks around. Before she was very dependent and stayed in the bed all the time. So not would I recommend this. How often I recommend this? As often as I can. If I find someone with blood pressure problems, after reading this, anyone that tells me they have blood pressure, sugar, anything, I recommend this to them. The thing is, most people are very skeptical because, you know, they expect it to come from some big pharmaceutical company, and I tell them, I'm just going on results, you know, and that's all I care about is results, and I have gotten some really good results using this product.